savings are driving an increase in the demand for medical tourism, as it's called. And according to a survey, nearly 80% of patients say saving money was a top priority. They can get a top quality surgery at a fraction of the cost. But you don't have to travel out of the U.S. to get some of those same savings. And our guest this morning will explain how. Meet Francisco Bonet of the Puerto Rico Medical Tourism Corporation and an orthopedic spine surgeon, Dr. Yamil Rivera. Good morning to both of you.
Good morning.
Thanks for being here. Francisco, let me start with you. Let's talk about health insurance. When we talk health insurance and you have a surgery, you're going to pay a lot out of pocket, no matter what. So we should investigate maybe more affordable options, right?
Of course, and for that reason, Puerto Rico is a better option. Puerto Rico needs to comply with all the standard regulations that apply in the U.S., but we have lower costs, around 40 to 60% lower compared to other states in the U.S., for example, Florida, New York, and California, for name a few. For example, a knee replacement in Florida, they will cost you $40,000, and in Puerto Rico, that will cost $15,000.
Wow.
So at the end of the day, it's 60% lower compared to the U.S.
From $40,000 to $15,000,
exactly.
$25,000 difference.
Exactly.
That is huge. Now, between quality and cost, which are very important, what other things should we consider whether medical tourism is the route for us?
It's not only that you are looking for lower cost. It's important the quality of the service. And in Puerto Rico, we are under the same U.S. health system, so our hospitals are Joint Commission accredited, and also 80% of our physicians are U.S. board certified. So at the end of the day, Puerto Rico is under the same U.S. health system, but we have lower cost. That's the main competitive advantage that Puerto Rico offers to the U.S. citizens.
And doctor, let me bring you in now. Besides knee replacement surgeries, which is very common today, my dad is actually having one in the next few months. What other surgeries do you perform and are performed in Puerto Rico?
We perform every kind of spine surgery back home, including minimal invasive spine surgery. And the costs are lower. Let's say like a spinal fusion, lumbar fusion could be $100,000 back home, over here. And back home it could be around 50 or 40. So the savings are a lot. And
with heart transplants as well, right?
A heart transplant could be $300,000, and in Puerto Rico it will be less than $100,000.
And hip replacements also performed there as well?
Yes.
Which is very important to note. A lot of people I know have gone to, let's say, South America, Central America, they travel abroad. A big difference from that to going to Puerto Rico, would you say, doctor?
Correct. And when you go to those places, you don't know the training that they have, and they don't have the certification that we go through when we are in Puerto Rico. That is the same as in the U.S.
And let's talk about your training. I know you even did your fellowship in Minnesota?
Correct. I did my subspecialty in spine surgery in Minnesota. That is one of the largest spine centers in the nation.
Francisco, you mentioned the health standards here are the same as over there. Be specific. What indeed all the surgeons there, doctors have to go through?
Well, 80% of our physicians in Puerto Rico are U.S. board certified. And also in Puerto Rico, we have 60 hospitals. 50 of that 60 hospitals are Joint Commission accredited. So we are the jurisdiction outside the continental U.S. with most hospitals under the Joint Commission accredited. So at the end of the day, Puerto Rico have the U.S. healthcare system in Puerto Rico. So it's very important for the U.S. citizens. The citizens doesn't need passport or visa to travel to Puerto Rico. If you would like to go to any other country in Latin America, you need visa or passport to travel to receive your medical treatment. In Puerto Rico, you don't need it. So.
Doctor, it seems to me that there's a lot of people that are just not aware of the fact that it's so easy. It's really like a next door neighbor. It's part of this country.
Right, it's just like traveling to a different city.
Right, exactly. From Miami, it's 2 hours because I have family there. Do you get patients who, after receiving treatment, they realize, wow, this was great. It was cheaper, affordable, and I got the best quality of care? Yeah,
correct. I have patients from Florida that they used to live in Puerto Rico and they moved to Florida, but they want to have their care done by a Puerto Rican because they feel more comfortable. So they travel back home and get their health care taken over there, and they love it.
And I know it's surgery, but it can also be a little vacation too.
Exactly. Puerto Rico is a great place to have a vacation. We have beautiful beaches. We have a spectacular rainforest at Yunque. So we have a beautiful destination, and you also have the medical services in Puerto Rico under the same U.S. health system that compared to the states in the U.S.
And Francisco, last question for our viewers out there who'd like more information. Where can they go?
starhealthcarepuertorico.com.
Thank you so much for being here this morning. Doctor, thank you for your time.
Thank you.
And if you'd like more information on medical tourism in Puerto Rico, visit the website starhealthcarepuertorico.com or just go to our website, thebalancingact.com. And we'll just keep on being.